Hello, family. Hello, family. Today, I want to talk to you about grinding, right? And I want to tell you or talk to you about why grinding can be dangerous for your teeth. First of all, many people don't even know that they're grinding their teeth. So, we have so many patients where you tell them, you grind your teeth. They're like, no, I don't. And we are able to tell, that people or patients are grinding their teeth either by looking in the mouth clinically or visually, or even through the x-ray. So you would see that the teeth are more flattened, the teeth has scuffs that look like, kind of like pointy-ish, kind of like little hairs, on teeth. That's kind of like the shape of teeth. And so when we see that those are flattened, we know that the person is grinding. You can even tell, and even tell better, if you have a digital scanner. You scan the teeth, and then you can actually see when you look at, there's a type of model where you can actually really see that the teeth have been grinded down. So yeah, so if your dentist tells you you're a grinder or a bruxer, which is a fancy word for grinding the teeth, or the technical word, take that, as them knowing what they're saying or what they're talking about. Many times people don't know that they're grinding their teeth because they tend to do that at night. So it could be maybe like if they're married, perhaps their spouse can tell them that they're grinding their teeth, and so on and so forth. So if you are a grinder, if you indeed are a grinder, usually, it happens because of stress, that's usual. And it would be the reason why, people would be grinding their teeth, and especially, grinding their teeth at night. So what are the dangers that somebody can face or be faced with when they are grinding their teeth? First of all, the enamel, which is the outside surface of the teeth, is very protective, right? It's kind of like an insulator. So that part, when it's grinded down, now you have the exposure of the inside part of the teeth, which is the dentin, that is more sensitive, right? So when that is exposed, when you're grinding, you can start experiencing sensitivity. So you have a lot of patients that come and they have sensitivity, and that could be caused by grinding. That's not the only cause of sensitivity, but definitely grinding your teeth or bruxing, it can cause sensitivity on your teeth. Okay, so that's number one. Another thing that can happen is that you can actually start fissuring or even cracking your teeth. And there again, there's so many patients that I have seen in my lifetime of being a dentist, whereby, they have cracked teeth. They have maybe chipping of the teeth or more extensive cracking, and that can also be caused by grinding their teeth. Okay, so with that, oftentimes, sometimes depending on where it is, you can do fillings. I'm talking about restorations, or, sometimes you may end up needing to do crowns, but, that grinding can still affect even the restoration. So that means that, if you are a bruxer and you have, a crown that has been placed because of, the sensitivity or maybe cracks, you can still grind down those restoration. You can still grind down through, those crowns or even those fillings, and they can end up breaking and things like that. Okay, so that's something that can happen as well. It can damage your teeth, but it can also damage the restorations that you have on your teeth. Okay, so that's the second thing that I wanted to talk to you about, that can be caused by grinding your teeth. Then the third point that I wanted to pinpoint today, because there's so many other, problems that can occur, but I want to also talk about difficulties or pain around your TMJ area, which is, the TMJ is a temporomandibular junction, or it's this articulation of your jaw where it articulates with the rest of your head. Okay, so when you're grinding, you can start experiencing soreness in this area, difficulty opening, and things like that can occur when you are a grinder. Okay, so TMJ, many people, they're like, okay, when I wake up at night, when I wake up in the morning, my jaw is sore. That's usually telltale sign of somebody that is, grinding their teeth. And yes, some people grind or clench their teeth at night, but some people do it also during the day. Okay, so those are three problems that I wanted to talk about: sensitivity. I wanted to talk about also cracking or breaking your teeth, and then another thing that I wanted to talk about would be TMD, or temporomandibular disorder, due to problems with grinding that can be stemming from, the fact that somebody is grinding their teeth heavily. So now that we talked about that, what can be the solution now that you know, or now that you have been told that you are a grinder? What can you actually do to alleviate or treat the problem? Okay, so if it's due to sensitivity, depending on the type of sensitivity, and your dentist will direct you accordingly, right? Perhaps, you may need a crown, or maybe, you may need some fillings to kind of cover those areas. Your doctor will direct you accordingly. Many times you would need a protective device, which is called an occlusal guard. And occlusion is just a fancy term to say how your teeth articulate with each other. So now the occlusal guard, what it's going to do, instead of you actually grinding your teeth down, yes, you're still going to be grinding, but it's now going to cover your teeth. And so it's going to protect your teeth from grinding against each other. And now it's going to alleviate that process by you actually having something that would protect your teeth. Usually, in fact, you would put it only on one arch. And so maybe your dentist will actually request that you may have maybe like a upper night guard, or a night guard that covers your upper teeth, or maybe your lower teeth. It will depend. There are different types, but your doctor will direct you accordingly. They will prescribe and have, usually they will take an impression or maybe a scan of your teeth, send it to the lab, and then the lab will actually send it back, and they put it on your teeth. They will adjust it accordingly so that you can experience some level of comfort. And then you'll be wearing that usually at night. Why? Because people often grind their teeth at night, right? So that's when most of the movement or the damages occur, and that will prevent you from even breaking your teeth even further. Now, if you have TMJ problems, then the dentist will direct you accordingly, so that these areas can be treated, or so that you can be directed accordingly. Okay, so that's essentially what I wanted to talk to you today about. And I'm Dr. Valerie Mukanga with Healing Wings Dental. This is the place where we help our patients maintain and regain their oral health so that they can soar in life. We also want to create beautiful smile. And that being said, if you don't have a dentist that you currently see, we are here to help you. Okay, you can give us a call, 972-213-0202. You can also request an appointment on our website, www.healingwingsdental.com. And we are located at 4101 West Green Oaks Boulevard, suite number 317. If you have found this simple information to be adequate, or to be impactful for you, please don't hesitate to share. Also, please subscribe to our channel so that you can get more tips when it comes to your oral health. All right, till we see you next time. Have a fantastic rest of the day. Bye-bye.